Welcome, Jasrita. Welcome again.
Thank you. Thank you.
And it's a very small paragraph to describe her, but because of time limit and everything, I will start with this small paragraph only, Jasrita. Okay.
Sure.
So Ms. Jasrita heads the brand marketing and CSR for Fortis Healthcare Group presently. And it's a big role because I myself has seen that how they are managed together, and CSR is a very big role that one has to play nowadays. And she has worked in service sector throughout, from hospitality to healthcare, and with a short stint in media sector throughout media sector. And cause-based marketing or purpose-led communication is very close to her heart. Her professional journey started as direct marketing executive with P&G, and then she moved to frontline sales at Radisson and the Oberoi unit. Marketing, communication, and public relation roles furthered her career graph at Max Healthcare, and finally, she transitioned to a brand marketing leadership position at Fortis Healthcare. And an additional charge, like I said, in sales. She is credited with lending the brand a higher purpose throughout private biggest public awareness and sensitization campaign on organ donation, which we must have definitely seen that more to give campaign was done, which is okay. So now I will be moving on to the questions that we have, Jasrita. So Jasrita,
Sure.
I'll start with my first question. Some sectors are amenable to digital. How should sectors with a large physical presence and long purchase journey, for example, healthcare and real estate, etc., tap into digital media?
Right. Yeah. Yes. So, see, there is this recent McKinsey report, which was tabled in July 2020, which says that we vaulted 5 years forward in our digital transformation journey, both on the consumer as well as on the brand side, in just a matter of 8 weeks. The study was commissioned during the time of the lockdown, and tabled in July. So sectors which have technically been a bit of a tech laggard, such as you mentioned, real estate, healthcare, government, legal, these kind of sectors are going to see the maximum digital adoption and transformation in this year, as they haven't seen perhaps in the last decade, and it won't be an over-exaggeration. Now come to see of it that 90% of the property searches are happening online already. Okay, in the time of the pandemic, now if you think of buying a house or moving into a house, when people were in areas which were locked down or curfew, you would have a 3D tour. You would have a 3D visual tour of the place that you're planning to rent out or place that you're planning to move into. So all these 3D videos, canvas ads, 360-degree tours, all of these things as we speak are being utilized by the real estate sector, right? And 90% of their lead generation is happening on social media platforms, if we see, so they're very, very sort of active on those platforms. So that's as far as real estate is concerned. If we talk about government as a sector, because certainly in India we wouldn't have thought that our government would be very, very active on social media platforms. But again, go back to the time of the lockdown, and you'd remember, Rohit, that many state governments, because health in our country is a state subject, so you had to follow the advisory of every state government. Every state government, every chief minister was sending advisories, putting up advisories through Twitter. So Twitter was the go-to medium for everyone to look at what's coming from, let's say, the office of Uddhav Thackeray, or from in Punjab, in the worst affected areas, etc. Coming to healthcare, there are enough researches and data to suggest that about 77% of the consumers search for a doctor online before coming and booking an appointment. 77, that's a whopping number. And some bit of this, digital adoption and transformation, this had started, the wheels had started to churn and move even before COVID. What COVID has done has acted as a catalyst, and like we said, is vaulted it forward, right? So therefore today, healthcare networks are dealing with consumers, patients and potential patients, which are remarkably discerning. And they're demanding transparency and two-way communication from their healthcare providers. So if you look at healthcare providers, what are the 4 or 5 areas that I can quickly talk about before tossing it back to you? most healthcare providers are producing a whole lot of video content. So video is being immensely used by the healthcare sector, whether it is to do with demos of, you know, the new technology, or it is patient testimonials for word of mouth communication. So that's number one. Number two, all healthcare providers are engaging, you know, using that for patient engagement, customer engagement, as we talk about, with both their patients as well as their potential patients through Facebook Lives, Instagram Lives, online communities, etc., communities for mums, birthing, etc., etc. You know, so all those cohorts that we talk about, you know, and lookalike audiences. So that's what healthcare is already doing. The third category is healthcare is also, networks are also trying to ensure healthcare compliance through whether it's a pill reminder or it's an ovulation reminder or it is your health check reminders, etc. So, you know, that health compliance sort of is also being done, you know, through them. The fourth is the use of AI. You know, during the time you would have seen Apollo, you would have seen Fortis, you would have seen actually all large groups put up some COVID screeners, screening chatbots on their website or in the facilities, etc., which A, helped in contact tracing and B, helped in mitigating the risk of infection to both the healthcare workers as well as the patients. And last but not the least, again, if you look at big healthcare chains, networks, you would see that pre-pandemic, now if you look at it, you know, about 20 to 25% of the pre-pandemic OPD volumes are being seen virtually through telehealth and virtual health platforms, right? So this is what's happening. And this is how, you know, where you mentioned that which historically, traditionally not were to the manner digital born or have a large purchase journey. These are some of the live examples of how digital initiation and adoption can happen in that particular area. Back to you.
Very rightly said, Jasrita. I think some of the statistics that you had put across, like 77% of people search online, is very true, and definitely pandemic has actually acted as a catalyst. Because if I remember around last year, a KPMG report very clearly said that this number was somewhere around 65 to 67, which is actually shot up by 10-15% post the pandemic happening. And
Absolutely.
Also video content definitely is the one which is playing a very big role. And we'll be talking more about the telehealth part of it. Because
Correct.
I remember attending some of the Ministry of Health and Family Welfare meetings, white papers, and I do very well remember, because that time it was a bottleneck for them to initiate the telemedicine thing, and now it is actually, if you see, every hospital is doing it, and it is shot up increasingly. So now
and the government has also legitimized it. It's now there as a part of the Gazette, and the Ministry of Health and Family Welfare is actually saying this to all healthcare providers, saying that this should be the preferred medium for follow-up care, or for chronic care. Telehealth, virtual health should be the preferred medium. You know, so therefore there is also a blessing and an impetus coming from government, which is much required.
Absolutely, and a big transition being seen post-COVID. I'll just move to the next question to you. That so you have a little bit of it been answered, but how have the healthcare brands leveraged digital medium during the ongoing pandemic?
I think first of all of them had to think about whether you are government, whether you're private, public, private, whatever, you had to think about public interest service messaging. That was the first thing. So I think all healthcare providers, regardless of whether government or private, you know, amped up their public service messaging in terms of social distancing, wearing masks, you know, contact tracing, telling about the travel history, etc., etc. So I think that's one thing that they did for consumers and as a service to the nation. The second is, again, which is very important, patient engagement through Facebook Lives, through Instagram Lives, through online support group moderations, etc. Because let's not forget, you know, when suddenly the country went into a lockdown, care for a lot of chronic patients was disrupted, So, and how do you disrupt suddenly the care for a dialysis patient? A dialysis patient needs that dialysis session. A patient who's undergoing chemotherapy needs that chemotherapy. And suddenly, if your hospital that you've been going to, let's say, all these years have been made into a COVID-only facility, which means it cannot take you anymore, then obviously you needed your healthcare provider to engage with you and allow the continuity of care to be maintained either through the digital mediums, virtual mediums, or to be able to route you to another facility, So all this patient engagement, allaying the fears, question answers, myth busters, wherever supply chains were disrupted for, drugs and consumables and medicines, for pharma, etc. All of that was done, patient engagement through social media channels, Facebook Lives, Instagram Lives, as I mentioned, virtual consult platforms, right? Because you had to mitigate the risk of infection. So many parts of the country were not only a lockdown, were under a curfew. And if you're in a red zone, what do you do if somebody is ill? So virtual consults platforms. I can talk about the group that I come from, that from the point of lockdown till now, we have done about 70,000 virtual consults. We've already sort of rendered. And a very important part which we don't talk about much, and I feel very strongly about it, is most healthcare providers, certainly us, we've run mental health helplines, we've done webinars, because suddenly life was disrupted for everyone. The physical remnants of the disease everyone knows about. Every day we are following those figures: how many people died, how many people recovered, how many people crossed 1 billion, whatever. But there is no statistic on how many people are dealing with the mental health impact, the negative mental health impact of the pandemic. Students are, because they cannot no longer go out and play in the playground. Sports people are, because they cannot train. Housewives are, homemakers are, because their work has quadrupled. People like us are, who have to work, manage home and all of that. So therefore, we were running and are still running a mental health helpline, which is like 24/7 available all days of the week, all days of the year, and in which free, the advice is given by counselors and psychologists in 15 Indian languages. So I think this is what healthcare providers did to varying degree, and certainly us. I think social listening. Everybody had to listen into social on your pages, to consumer feedback, to complaints, etc., and had to be more agile in terms of your response. Like I said, Twitter at that point in time had become the go-to medium for everyone to say, what are the latest lockdown guidelines or unlock guidelines, and where can we go? What is open? What is not open? So therefore, with a captive audience there, healthcare could communicate to them, whatever they wanted in terms of public service. And last but not the least, again, very important, is also what healthcare did is celebrate the stories of hope. So while there are numbers that we read every day, but those numbers, those are numbers of gloom. And I'm not trying to, sort of take the gravity away from it, but the stories that we need to celebrate are stories of hope. So when an 86-year-old gets discharged from a hospital, or when a 90-year-old is able to beat COVID, so those stories of hope, which are made into a video, or, which we try and make them go viral, or put it out on news platforms. So I think infusing this positivity and celebrating the healthcare workers, doctors, nurses as the cheerleaders, as the real heroes of the pandemic, and the stories of hope. These are some of the things which, healthcare has done in this pandemic.
Okay, so I move to the question that we have, and the question is for Jasrita. So Jasrita, considering what happened with Paytm in India yesterday, it had raised many questions on how brands like Google, Facebook are unilaterally controlling the digital ecosystem of the world. In such a competitive space, what do you suggest for an aspiring digital marketer to make one mark in the industry?
There are two questions actually in this question. One is relating to the controversy. So, what's the take on that? And the other is that people who are coming up the curve, what is the future for them? So there are actually two parts to the question. I'll try and address both very, very quickly because we are horribly short on time. See, the first part of the question, what you do with these big tech giants is, governments are, their growth has happened at such an alarming pace that governments could never keep pace with that. This is what has happened, so you got to first understand the why of the problem before we come to the how to deal with it, right? But now governments around the world, civil societies themselves, and ethical hackers, ethical techies are waking up to this reality, and they're already raising the noise on making these platforms, holding these platforms more accountable. So that's one thing that's happening already. In India, I don't know if you're aware, because you asked this question from Indonesia, there's already a parliamentary panel which is being headed by a young, parliamentarian, which is calling Ajit Mohan, the head of Facebook India, and to come and say, because there has been data that is there in the public domain that they helped one of the parties win at the cost of all others, and that party is in power right now. So those kind of things are there. So I think that one is to holding them accountable, both from society, from technology, which is from within, and from the government. So that's once that happening. The second is, whenever we've seen in the history, if we look at economics and we study it, or marketplaces, whenever monopolistic or duopolistic kind of marketplace comes in any sector, that is the time when maximum disruption happens, and that is the time when innovation happens. So while these platforms maybe a decade or two ago were disruptors themselves, but today they stand at a risk of getting disrupted, their business models getting disrupted, with perhaps a more ethical and a more transparent sort of a platform, right? So those are two things which are, I had to say, for the first part of the question. The second part of the question is, anyone who's coming up and anyone who's watching, I'd like everyone to go today over the weekend, go and watch this documentary called The Social Dilemma. If you haven't watched it already, please go and watch it, because Social Dilemma features people who were the founding team members of Facebook, Instagram, Twitter, Google, etc., etc. So please do that, and that will give you a lot of idea, more than what any one of our speakers can say here. There are many search engines. You asked that, you said Google, Facebook, etc. There is a search engine called DuckDuckGo. Duck as in the duck. DuckDuckGo. If you use DuckDuckGo, it is a more secure search engine than Google. And surprise, surprise, it doesn't serve your search history like Google does, and like Bing does, and like Yahoo does, right? So those alternatives are there. It is up to us whether we are using those alternatives or we are going with the most popular one. Okay, so if we as users, give more power and more usage and more consumption on the alternatives which are safer than these big tech giants, okay, then there is already an alternative, then it will become a viable and a feasible alternative, right? And last but not the least, there is the Data Security and Privacy Bill, which is coming up. There is a cookieless future, which we are looking at, that no longer cookies will be tracers. So all those remarketing, retargeting, all of those unethical things which were happening, also in digital marketing, will have to sort of cease. So that's my 2 bits to that. But do go and watch The Social Dilemma, all of you, please.
Definitely, we'll be watching that, and definitely I'm also waiting for a day when this cookieless time period comes, because it's somewhat very irritating. Some people will not agree to me. Barry, I don't know whether you will agree to that or not, because remarketing plays a very big role for us when it comes to increasing the business. But yes, I also know that remarketing in our setup, in healthcare setup and all, is not very much allowed.
It's not allowed. Yeah,
it's not allowed, right? It's simple. No, you can't even run remarketing on Google. You can't even do double click by Google for healthcare. So that